My name is Tom Snelling. I'm the head of the Health and Clinical Analytics team at the University of Sydney, and I am a consultant in infectious diseases at the Children's Hospital at Westmead. It's estimated that traditional clinical trials can take 17 years before the results of the trial are actually implemented in practice. 17 years is a long time in the life of a child. The learning approach that we take means that we can start implementing data, implementing evidence as it's accumulating to improve the management of children. Clinical trials are typically set up as classical experiments, which means that you decide that you're going to enrol potentially hundreds of children in a trial, and then you're not going to look at that data until you've enrolled the last child. We need to really shrink that time from when evidence is being collected to when that evidence is implemented into practice. COVID-19 has really been a huge wake-up call for health departments, healthcare providers around the world, that this is a situation where we have a new disease and we really need to learn as quickly as we possibly can about how to manage this condition that we've never seen before. So one of the things that we've been doing has been trying to get jurisdictions, states, hospitals from across Australia to adhere to what we call a common data model, and that's like a standard rail gauge or a standard language that allows us to share data, share information and share insights as quickly and as efficiently as possible. Diseases like COVID-19 don't stop at state boundaries. They cross over countries and affect people everywhere in the world. We all stand to benefit from learning about the healthcare experiences of patients, not only in our city, not only in our hospital, but from across the world. We've got three major areas of focus to start with. So we want to learn as quickly as possible about how best to manage children with serious bacterial infections. We also want to learn as quickly as possible how to manage children who have cystic fibrosis. And we also want to learn how to best manage children who have lower respiratory tract infections. To do that, we want to collect information about these children in a standardised way, and we also want to take data about those children directly out of the hospital electronic medical record system. We transfer that data into a secure central repository. Then we apply Bayesian algorithms in order to learn as quickly and as efficiently as possible which are the sorts of treatments that are associated with better outcomes. And also learn for specific children with particular characteristics what are the specific treatments or management options that are best for them. And then we want to be able to provide that evidence back to the clinician at the point of care, so that the clinician who has a child in front of them, they can make an informed decision about the best antibiotic strategy, whether a child can be safely managed at home or needs to be admitted to hospital. Even though we anticipate that there will be huge rewards for implementing these platforms, the platforms themselves take a huge amount of effort to set them up in the first place. So these things don't exist. At least they don't exist at scale. In order for us to be able to impact on the treatment of every child who presents to hospital, there's still a huge amount of work that needs to be done to set these systems up, to bring hospitals up to speed, and then to scale them broadly, because we want to set up solutions that are not just going to benefit children in Sydney. We want to come up with solutions that allow children wherever they are in Australia to participate in this learning health environment, and also not only children in Australia but potentially children across the world. So I can't think of any better way to invest in the health of children than to invest in platforms that allow us to better evaluate the treatment that we're giving, but also to learn as quickly and as efficiently from that experience to inform how we treat patients in the future. This is not a new discovery, it's not a new drug that may or may not be implemented in 10, 15, 20 years' time. The solutions that we're coming up with are designed to inform the better management of children today. We're really aiming to almost completely redesign the way that we do research and the way that we implement research into clinical practice. So it is a huge problem, but we have the tools to do it.